CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.
Hi everyone, welcome to CollabTalk, a new talk series by Collaborative ABA Services that provides information and resources about autism and also everything in between. I'm Alicia, the founder of Collaborative ABA Services, and I'm always here with some amazing team members. Team?
My name's Katie, I'm an occupational therapist.
I'm Bree, I'm a BCBA.
I'm Meg, I'm a licensed social worker and registered behavior technician.
So today we're going to be diving into a topic that confuses many people, meltdowns versus tantrums in autistic individuals. They may be similar, but believe it or not, they're very different. For example, you have a kiddo in the mall that's screaming, crying, and might be holding their ears. The first thing that comes to mind, you might think, hey, this kid is definitely having a tantrum. But are they really having a tantrum, or are they experiencing what we call a meltdown due to sensory overload? So it's important to know the difference between the two to decrease stigma and also help inform parents or caregivers and providers on how to respond appropriately.
Mm-hmm. Yeah.
So please note, we always got to do a disclaimer. The purpose of this episode is for educational purposes only and not a substitute for individualized professional advice.
Mm-hmm. Nope.
So team, let's dive into this topic. First of all, let's kind of talk about what tantrums are.
Yeah.
So first thing, when we look at tantrums, one thing is that it's very purposeful or goal-driven. So often when a child wants something or, like a toy or a snack or activity or attention, or they want to avoid or escape something, for example, they don't want to go to bed or they don't want to do chores, or, you ask them to do something that they don't want to do, a lot of times you might see tantrums because the purpose of it is to avoid something or to access something for most parts.
Right.
What are some other things in regards to like tantrums?
They stop when they get what they want.
It's the same thing.
They're very specific. They're about one specific thing.
Right.
Like I want this or I don't want to do that. Like it's not like I know we'll talk about meltdowns, but it's not like based on a whole bunch of things. It's kind of one specific thing.
Mm-hmm.
They're very developmentally appropriate in a way,
100%,
right? Like
Right.
it's known for toddlers and others.
Yeah.
A way to test the waters.
Yeah, exactly.
Right. And it's also linked to that lack of communication or frustration.
Mm-hmm.
Which is why they're more prevalent in toddlers and younger children
Exactly.
because they don't know how to advocate for themselves or to communicate what they need at that younger stage.
Right.
Right. So let's dive into what a meltdown is. So we already talked about tantrums, so let's go right into meltdowns. And what I can say the first thing is, in opposite of a tantrum, meltdowns are not intentional. So they're not goal-directed. They're most likely due to like the child or the individual feeling overwhelmed, often like some type of sensory overload, or, they feel some type of stress or like big emotions.
Yeah.
What are some other key things to think about when looking at meltdowns?
I think kind of the way that you should approach it is different for a meltdown versus a tantrum. Like if your child is having a tantrum, it's okay to be firmer and be like, nope, like we need to go to bed, or no,
Right.
we're not going to do that right now. Like, because it's focused on kind of what they want. So the way that you approach it and kind of having those boundaries makes sense and it's appropriate. If your child is having a meltdown, they're emotionally and sensory not available. So even if you are firmer or you set some of those boundaries, it doesn't always help, or it may not be the way to get out of that because the child is literally just kind of, I say coming apart. I say a good way to think about it is adults have meltdowns. Like when you're at the end of the day and you're like, oh, but I don't want to do this, oh my gosh. And that kind of feeling of complete just blah, that's a meltdown. Versus tantrums are kind of more focused, and adults don't typically have tantrums because we're able to communicate what we want.
Right.
It's almost like what you're saying, like they're having so much going on.
Yes.
It's like sensory overload and they just can't stop it like a
They
tantrum.
can, yeah. And it also depends on what caused it too. Like a lot of
Right.
times meltdowns are cumulative. So it's at multiple things have happened and then, okay, I've had it at this point, I can't take it anymore. Versus those individual things can sometimes be tantrum based.
I think too, with the communication, like you were saying, not knowing how to communicate that, or and you're trying to help, what do you need? It seems like you're upset, them not even being able to communicate, I need space, just
Right.
stop
Yeah.
talking, it's adding to it, you
Right.
know?
Right. And also with meltdowns, it can kind of also look intense.
Yeah.
Tantrums, of course, you have a kid that's screaming, yelling, flopping on the floor. But also with meltdowns, they also might be crying, yelling.
Yep.
Another thing might be they might be holding their ears, which might be kind of like a clue
Yeah.
that there might be something going on in their environment. Maybe the environment's too loud, shutting down, or they're just needing to get out, like to escape because they're just overstimulated.
Yeah.
I think being in this environment too, I've learned a little bit, like, I think parents know too, like the way they're crying.
Yeah.
Right.
Like when it sounds like it's painful, like they're physically in pain. Like,
Yeah.
versus like just screaming their brains out
Yeah,
until somebody's like, please stop. I'll give you anything.
Right,
you know?
right.
And also with meltdowns, like we talked about, Bree, you were talking about tantrums are more likely with like developmental with the younger kids.
Right.
Whereas meltdowns, they can happen at any age.
Yes.
Any age, yeah. And I think the thing too that sometimes can be challenging for parents with children with autism or otherwise, like when you're in public and your kid's having a tantrum or a meltdown, it's hard. Like you're laying on the ground, kicking, screaming,
Right.
having a tough time. Like that happens, right?
Right,
And
right.
with tantrums, sometimes people are like, oh, like that child's poorly behaved. With a meltdown, it's like there's nothing you can do about it.
Yeah,
The kid is
yeah.
not doing that on
No.
purpose. The kid is just done.
Right,
Yeah.
right.
And so we talked about, what a meltdown is and also what tantrums are. So the next thing to talk about is some key differences. And from what I'm hearing and what we discussed is the intent, right?
Yeah.
So kind of goes back to at the beginning when we were talking about tantrums, it's goal oriented. Like they want something or don't want something.
Yeah.
Whereas, a meltdown is more along the lines of, hey, I'm feeling overwhelmed, I'm having an overload.
Yeah. More I can't do this versus I don't want to do this.
Right.
I'm just
Right.
not available. In OT, we talk a lot about kind of the way that you would approach a meltdown versus a tantrum. So a tantrum, you might maintain an expectation, like, nope, we're going to bed. Like, that can't change. But it seems like you're having a tough time, so I'm going to help you meet that expectation. Versus if you're having a meltdown, it's like, okay, we're going to do this. Oh, you can't do that right now. Okay, why don't I change my expectation and kind of put regulation and
Right.
calming you as my main priority, and then we can maybe go back to that later or change it if we need to.
Right.
I think like too, the differences in like de-escalating and kind of like debriefing afterward. Like with tantrums, there's a big difference between, punishment versus
Right.
Yes.
what's what I'm looking for.
Like following through.
Right. Yeah.
Yeah.
Kind of like the consistency, right?
Right,
Like you're not
yeah.
like setting a bedtime routine is not a punishment. It's like, yeah, I know you were upset about this, but like we have to do this. This is important kind of
Right.
thing.
Yeah.
Right. And then with like meltdowns, kind of debriefing and like, I see how you're feeling, like comforting them, reassuring, and teaching that functional communication. When you're feeling that way, you can say, I need space, things like that.
Or how to like advocate for themselves, like you said, like needing space, or like if something's loud, like you can go grab your headphones, right? Like how they can help solve it too, to prevent it getting to that meltdown.
Yeah.
Discipline.
Yes.
Punishment
Yeah,
versus-
yeah,
Yes, exactly.
She was like, let me think about this.
And how like tantrums you can be
Yes.
disciplined without punishing, and
Yep.
then like I said, with the meltdowns, there shouldn't be disciplined, but
No.
kind of worked through and how to promote that functional communication and being able to advocate for themselves.
Yes.
And I think kind of like when you said the discipline, that made sense to me in terms of like how parents kind of perceive it. Like sometimes kids will be having a terrible meltdown. The parents like, oh no, I can't give them what they want, or I can't do this because then I'm setting a bad precedent. But knowing the difference is important, right? Like if your kid's constantly having tantrums and you're modifying everything and kind of giving in, well, yeah, that'll lead to some behavioral challenges because that's intention driven versus if a child is just coming apart and having a really tough time and we're trying to like create discipline around that, it makes it really hard because kids like, I'm stressed, like I can't, right? It's harder.
Right. And another key difference too, we talked about earlier as far as like the age and developmental level, right?
Yeah.
So tantrums, are common, you said like in early childhood. And as, the child develops, we normally see like a decrease as they get older. Whereas like we mentioned before, meltdowns persist across the lifespan for individuals on the spectrum. So that was another key difference. So now let's go into what parents, caregivers, and providers can do to support, an individual on the spectrum that might be having a tantrum or a meltdown.
Yeah.
And kind of goes back to what you were saying, Katie, about just kind of knowing the difference between the two. As like what you said about meltdowns, they might not be available to kind of debrief or, so, and kind of also goes back to what you were saying, Meg, too, about just, the discipline and the difference. So those are some key points. What are some other things that parents, caregivers, and providers can do?
I think sometimes it's hard when kids are having meltdowns to like, especially in public, when people
yeah.
are looking at you and you have this pressure and this, sometimes this feeling of embarrassment, it's really hard to push past and kind of think about like, what does my child need right now?
Yes.
Why is this happening? Not instead of like guilty as charged, like how do I make this stop? How do I make this stop? Because you want it to stop, but you don't. It's hard to think about what they need for them to feel okay.
Right. And kind of like what you were saying, like both behaviors do communicate a need, right?
Right.
But the question is, what is the need?
Yeah.
And the other thing to kind of think about too, kind of like what you were saying in the public, as a parent, caregiver, or provider, you want to always stay calm, regardless. And also, set those boundaries. You want to encourage communication of needs appropriately, or that functional communication as well. Any other key things?
I think sometimes less can be more. Like, I think, like, one of the biggest things I've seen with, like, tantrums is, when someone tells you no, it's not a fun feeling, right? And then every time the kid asks, well, can I have this, and you keep saying no, that just makes it worse, right? So it's like, I really want this, versus, hey, I've already answered that question, buddy. We're not going to do that right now. And then kind of just, like, letting that go and letting them work through it. Versus for, like, a meltdown, kind of giving them space or not engaging with them. Like you mentioned, Meg, like, what do you need? Do you want this? Sometimes that can be too much. So even just kind of taking a breath and seeing, like, okay, let's just give this a minute. Just sometimes that space can be helpful in both situations.
Yeah, and I think too, like with like the onlooking, like I was saying, sometimes I feel like you want to give an explanation, like, oh, they're on the spectrum, they're having a meltdown, I have to wait it out or whatever. Like, I think just ignoring the attention.
Yeah.
Because when you're talking about it and it's happening, it's probably not going to help the situation,
Or you can use like a short phrase like, my child's having a hard time right now. And just leave it like that. So very short, sweet, to the point. Also too, I know, like I was saying before about like the staying calm and setting boundaries and stuff. I think that's also more for like tantrums based.
Yeah.
But then when we're looking at meltdowns, like when they're feeling overwhelmed and they can't really help themselves, some things to kind of take away is, you want to provide that safe environment to reduce that overstimulation, and also, give them some time and support them through regulation is key. Any other things that we can, that parents or caregivers or providers can do?
Maybe even like finding what some of the precursors are for like either a meltdown or the tantrum, like and strengthening the communication, because we know that that's the reason typically they're engaging in some kind of tantrum or even a meltdown. They don't have the ability to communicate it.
Right. And then kind of going back to like the meltdown piece and kind of like what you were saying about the punishment earlier, also avoiding punishment for meltdowns. Because it's not that they're misbehaving, it's that their sensory, they're feeling overwhelmed with life. They're overstimulated.
It's a communication more than like a deliberate choice at that point.
I think being proactive too, like being over prepared. Like I know that there's
100%.
any possibility that there's going to be noise or like non-preferred noise and things like that. Like bring the headphones. Bring the things that. If they like to wear their hood when they wear a sweatshirt, bring a hoodie to block out whatever. I bring a backpack everywhere. Full of the things that could possibly be needed to prevent the meltdown.
Set everyone up for success.
Because it's easier to kind of grab something really quickly versus if you don't have it, be like, okay, what can I do in this moment?
Right. When you're out in public and
very important.
Everyone's watching.
So it kind of goes back, kind of like what you were talking about. The next segment, we're going to talk about prevention and support strategies. So to piggyback off of what you said, being proactive, right? Is huge. Another strategy would be, working with that child to teach those self-regulation skills. So kind of like that, I call it kind of like a toolbox that you carry, like working with them or teaching them how to self-regulate using those strategies or tools that they have, or even use of visual supports. Any other ones?
I think prepping for things, like if there's certain triggers, say for a tantrum that you know are consistent, like, oh, we're going to go do so. I think it happened a lot. I'm the oldest of 8 cousins on my parents' side, and one of the biggest tantrums pretty consistently was going to somebody else's birthday party and you didn't get to open the presents. That was a big one. So we would always prep or talk about, like, I know I could hear my aunt talking to my cousin saying, okay, this is so-and-so's birthday, like this is what we're going to do. So like prepping for some of those things and having those expectations can help decrease some of the triggers of a tantrum, and make it a little bit more, like, being more prepared for some of those things.
The pre-teaching, like what to expect, what will be denied.
Yep.
So like creating predictable routines in advance to decrease the anxiety, basically.
Yeah, and like you were saying, too, visuals, like the visual schedules are
Yes,
helpful,
yeah.
especially if it's
100%.
unexpected or things may change.
Also providing breaks before,
Yes.
you know, they feel overwhelmed. Like, we call it precursor behaviors. So, like, these are the little behaviors that lead to the big outburst.
Yeah.
So if you're noticing that, like, your child is starting to get antsy, it's like, ooh, I think we need to go take a break
Yeah.
before it gets to the big boom.
Right.
And also, you want to also kind of like what you were saying earlier about strengthen that communication
Yeah.
to reduce, you know, that frustration. So thanks, guys. We had a very good talk today. What are some key takeaways from our discussion?
All behavior is a form of communication.
Yeah.
We say
Yeah.
it all the time.
Right. And
Hope for the best, plan for the worst.
Yeah. I like that.
100%.
And also goes back to Meg, what you were saying earlier about like recognizing what the child or individual is trying to communicate is huge, because if we can figure out what they're trying to communicate, we can be more helpful.
Yeah.
And also the biggest thing, and kind of like what we talked about today, is understanding the difference
Yes.
between a meltdown versus a tantrum, so that, you know, the parent, caregiver, or provider can respond appropriately and more effectively, and also with compassion, especially if the child is overwhelmed already. You know, they're having a meltdown because they're overstimulated. You know, responding in a way that's, you know, disciplinary, because they're so-called having a tantrum, can be counterproductive and also insensitive to that child who may be overstimulated. And we also don't want to, you know, alleviate tantrums or meltdowns altogether. The goal really is to support the child's ability to self-regulate, and also we want to help support them communicate effectively. So communication is key.
And I think especially working with children with the autism population, they feel feelings and experience things much more intensely than we do. So being aware of that, like something that we might not see as a big deal, might be really upsetting for them, and kind of being compassionate and knowing, okay, this is actually really hard for them.
Right. So thanks, everyone. I think those are some very important key takeaways from our episode. Thanks for tuning into this episode of CollabTalk. If you found this information valuable, please don't forget to like, subscribe, and also hit the bell so you never miss an episode. Got thoughts or questions? Feel free to drop them in our comments box. We would love to hear from you as always. Until next time, let's keep this conversation going. To learn more about Collaborative ABA services, check us out at our website at www.collaborativeabaservices.com, and also our additional social media pages and our online store, by the way. Our media pages include Instagram, Facebook, LinkedIn, and
TikTok.
TikTok. Until next time, goodbye.
CollabTalk is a copyright of Collaborative ABA Services, making a difference in children's lives.